Hello and welcome everyone to this early career resilience webinar. I am so excited to be coming to you today with this content and eager to dig into talking a little bit about the importance of early career resilience and ways to help build some of that resilience. I am Dr. Tiana Kelly. I am coming to you from the United States in Pennsylvania. I hold a master's degree in clinical mental health counseling and am a licensed professional counselor here in the state of Pennsylvania, and I'm also a national certified counselor. In addition, I hold a doctorate degree in prevention science, wherein my focus was on veterinary suicide prevention, specifically looking at the influence of higher education. I come to you today through my volunteerism with Not One More Vet, which is a nonprofit organization dedicated to reducing suicide and elevating wellness for veterinary teams and students. And some of the ways that we do that are through things like peer support programs and mentorship opportunities. We have grant programs for individuals and clinics or hospitals in crisis. We have mental health programs for workplaces and schools and different wellness programs. And we're also active in research efforts to advance wellness and reduce suicides. Now, throughout today's presentation, you will see that I have embedded a couple different QR codes for different resources that I talk about. And the first one here is linked to Not One More Vet's website. So throughout the presentation, please feel free to, grab your phone, get your camera, and aim it at that QR code so that you can snag that resource and keep it handy with you, should you be interested in looking at it further after the presentation. Now, let's get a little roadmap of where we're going today. So this presentation is really all about building awareness of what, you might ask, of mental health and the veterinary profession. We're going to talk about what are some different risk factors for mental health adversities and protective factors for boosting mental health and wellness. We're also going to talk about the state of the field. Where are we at in terms of the way new grads or early career professionals are feeling with regard to their mental health as they're transitioning into a new career. We'll also segue and talk a little bit about some key topics that we're seeing surfacing as prevalent within early career professionals, those topics being things like compassion fatigue and burnout and imposter syndrome. We're going to give an overview and talk about some symptoms and exacerbating factors of each. And we're also going to have a little exercise to work on building our own sense of empowerment. Up next, we'll talk about early career resilience, which will entail, knowing the warning signs for yourself or for someone else that you might be experiencing a mental health adversity. We're going to talk about ways to intervene and prevent mental health adversities. And we'll give a little session on stress management 101. What do we do with all the stress that we now carry as new career professionals? And we'll take a few moments to just talk about some indicators of a healthy workplace. What do you look out for as you're job searching, for instance? Now, through this presentation, it's my hope that you'll be able to take away at least 10 risk and protective factors for adverse mental health in veterinary medicine, and that you'll be able to identify at least 3 adverse mental health outcomes specific to vet med. You'll also be able to provide a working definition of compassion fatigue and burnout, and provide at least 5 defining features of imposter syndrome. And then finally, I'm hopeful that you're able to learn and practice at least 3 strategies for coping with the different topics that we talk about, compassion fatigue and burnout and imposter syndrome and just general distress. So mental health and veterinary medicine, why does all of this matter? I'm a person who likes to know the whys, as you might be able to tell, because I'm asking why a lot already. I like to ask the whys, but I fully know and understand that sometimes asking why only leads to more whys, only leads to more why questions. But let's just dive right in. Okay, I asked that question, why dedicate an entire webinar to early career resilience? What makes early career professionals at risk for adverse or poor mental health outcomes? You have any speculations, any thoughts maybe? Have you ever wondered if and/or why early career professionals are more at risk for things such as imposter syndrome or even symptoms of anxiety or depression or maybe even loneliness? Today's presentation is going to cover all of that and more. But let's begin by just listening to a fake, though reality-based anecdote from a new graduate named Jane. My name is Jane. I am 1 year postdoc, and I have a nagging feeling that I'm just not fit for this profession. I feel like such a fraud, and that I only landed this job out of luck. I completed my education and training in the western part of the US, and I relocated to Pennsylvania for work shortly after graduation. Schooling was tough. There was some demand in curriculum, some really high expectations, and I personally struggled with depression and anxiety the whole way through. My cross-country relocation post-grad has led to professional isolationism as I've had to start completely anew in building my professional network. I think being a veterinary professional is truly rewarding at its core, but the day-to-day work stressors are weighing on me emotionally, physically, cognitively, the way I think about the career and myself. My struggle to balance work and life as a new wife and a soon-to-be mom is compounded by my long work days, the hours that I have to be on call, and just the fact that after a day of caregiving and offering compassion, I feel like I have no more left to give to my friends and family. Like, for instance, yesterday, my workday started out great. I had the adorable presence of an 11-week-old puppy coming in for routine vaccines. But what quickly followed was emotional distress and a host of ethical dilemmas. My colleagues helped me debrief and brainstorm through these dilemmas, yet I still felt so alone in the struggles that I had. I felt very anxious, but it was hard to talk about that. And I think I'm finally starting to understand what stigma is all about. I could change careers, right? But that's just not in my personality. I feel like I'm determined to persevere. And besides that, I have this mountain of student debt, $174,000 to be exact. I feel like I just have to keep trying harder. Well, I have to get ready for another day of work. Cross your fingers, your toes, your paws with me that there are no emergencies that delay my schedule. I can get out of work on time, or no clients who become argumentative with me. Hmm. I also hope my practice manager listens to that feedback I have about trying to create our own schedules. Is this what burnout feels like? 'Cause certainly I can't be burnt out already. Okay, so as you heard that anecdote, I'm curious, what risk factors or mental health experiences even did you hear that Jane was experiencing? First and foremost, imposter syndrome was highlighted as she says she feels like a fraud and she only got her position out of luck. We heard professional isolationism. She relocated post-grad. She felt this sense of disconnect from her colleagues, even as she was debriefing, to the people right there in her inner circle. We heard psychiatric conditions like anxiety and depression, both of which are prevalent in veterinary professionals, especially those early in their careers. We heard school and work, trying to balance, and how tough it was, how demanding it was, how hard it was to find work-life balance or work-life harmony. And then we heard about ethical dilemmas, client maltreatment, student debt, stigma toward maybe help seeking, maybe receiving help, just talking about mental health in general, all of which are risk factors and hazards inherent within the field of veterinary medicine. Now, in the last slide, you've heard me use the term risk factors. You've heard me use the term protective factors, and you'll hear me use this terminology a lot throughout the webinar. So let's all get on the same page in case these are terms that you haven't yet heard before. Now, protective factors are the circumstances or situations, maybe policies and procedures, or even people that protect an individual against poor mental health outcomes. So that is, they reduce one's risk. Risk factors, conversely, include those same, circumstances, situations, policies, procedures, people that increase the risk of experiencing adverse mental health outcomes. So how about veterinary students? Let's dig right into the population that this webinar is focusing on. I'm going to get a little bit into a prevention discussion here by acknowledging that so much of the time we look at the individual as being responsible for protecting themselves against things like compassion fatigue or burnout or even imposter syndrome. We will sometimes hear like it's the student that needs to do more self-care. Maybe, okay, quit your job so that you have more time for your studies while you're in school. You have to be able to set boundaries. And while I, as a licensed therapist, absolutely agree and promote that individual responsibility, I cannot state enough that in order for preventative efforts to be adequate, there has to be intervention across multiple levels. So what that means is, you plus your friends, plus your academic program, plus your larger academic institution needs to look out for you too. So take, for instance, the first bullet on this slide. You have very minimal, if any, control over the high entry requirements expected of you as you started this academic journey. While things like boundary setting and self-care will help buffer against some of those risk factors, you can't wholly and totally self-care your way out of demanding curriculum or those high entry requirements, for instance. So there's higher level interventions needed, such as like lunch and learns or this Wellness Week webinar, for instance, that help to provide you with like the knowledge and the skills and even a reprieve from the high pressures and demands you're under. And admittedly, sometimes just having others acknowledge our pain or give credit to the hard work that we're doing can be a protective factor against some of these risks inherent to being a veterinary student. Let's go a little fast forward. And now we imagine ourselves in the career of vet med. We're working, we're new professionals. Let's talk a little bit about what surfaces based on our research and the literature that exists right now. Now, it's no surprise, especially as we heard that anecdote from Jane, that veterinary professionals are under some intense demands. Maybe that's you're working an intense case, you've got some long work days on schedule this week, you've got some on-call hours, just to name a few. There can be a lot of pressure to do the work that you do day in and day out. Now, ethical dilemmas, high-risk situations on the job are frequently cited as sources of distress for vet professionals. So think about maybe you're getting ready to perform a new surgical procedure. It's high risk. There's a few ethical dilemmas wrapped up in there. That can surely be anxiety-provoking and distressing to prepare for. Poor work-life balance. This is not necessarily isolated to the veterinary profession, though we see it in the veterinary profession. Again, because of the occupational demands inherent within the field, it can be really challenging to find harmony between your personal and your professional lives. And that absence of harmony between time spent at home and time dedicated as a veterinary professional can lead to things like anxiety or general psychological distress, compassion fatigue, and maybe even burnout. Now, in addition to your daily duties, the vet profession also sees things like client maltreatment and their accompanying high expectations of you, both of which, again, can be a driving force for anxiety or poor mental health. Think about being on the phone, for instance, with the client who's placing unrealistic demands on you, or perhaps they're maybe even spewing harsh comments or posting them online for everyone to see and read. Not only can that type of maltreatment raise anxiety, but it can also contribute to imposter syndrome, for instance, which we'll shift our focus to and talk about momentarily. Now, we heard from Jane about professional isolation. So feeling alone or actually lacking support from others, personally or professionally, increases that risk for poor mental health. So having support from leadership, from colleagues and friends and family helps to elevate our protection against psychological distress. And I'd argue drastically so, because we do not and we cannot thrive in isolation. Regardless of your role in vet med, the daily duties of veterinary professionals expose you to traumatic situations. And this might include ongoing exposure to death or enduring animal bites or injuries from patients, or again, that client maltreatment and cyber harassment. Supportive interventions like opportunities to debrief, having veterinary social workers on staff, or having EAP referrals or counseling referrals on hand. All of those things can be truly beneficial in protecting against some of these trauma-based risks. And finally, that feeling of failure or being an imposter can elevate general psychological distress, especially anxiety. And what might cause you to feel like a failure as an early career professional? Maybe it's not finishing your to-do list. Maybe you missed a diagnosis or you messed up on a treatment plan, and perhaps it's really nothing more than a feeling and not rooted in fact or reality. Still valid, right? If you have that feeling, but it might not be a fact. It might just be feeling. Okay, how are we feeling as we've covered some of that material on risk factors? I know from an educator standpoint, it can feel um, a little nerve-wracking, maybe even a little defeating to run through all of those different things that just don't seem to be working right in the career. And if you're feeling that way too, it's okay. You're not alone. What can be helpful is to dig deep into our prevention principles and remember that with adequate protective factors and supports, much of these risks that I just covered can be prevented or mitigated if they happen. So let's talk about building hope. Let's look at protective factors for mental well-being in vet med. Now, admittedly, there's not a ton of literature about vet med specific protective factors, and that's also not isolated to the vet profession. In general, our research tends to be pretty deficit focused as opposed to strengths based. However, what we do know for veterinary caregivers is that protective policies in terms of, for instance, like euthanasia practices or creating protective environments through psychological safety in the workplace, efforts to promote connectedness to caring colleagues and personal supports, and even just possessing a personal belief that it's necessary to cope with these different occupational risk factors are all protective and help to elevate our sense of mental health, our sense of mental well-being. There's some other protective factors on the slide here too, such as like having the openness to seek help and receive an accurate diagnosis or an adequate treatment plan, having your basic needs met. That's a huge one. You know, stable housing, financial stability. You need those basic things before we can really start to work to elevate your sense of wellness and mental health. Also, reducing access to unhealthy behaviors or maladaptive coping approaches like substance use. So reducing access to unhealthy substances is protective against adverse or poor mental health. Now, I always like to incorporate a little, hands-on, tangible skills exercise, and this feels like a good opportunity to just maybe take a little bit of a brain break. In this exercise, we're going to talk about and practice what's called 5-4-3-2-1 sensory grounding, or maybe you've heard it as just like 5-4-3-2-1 grounding, or maybe even mindfulness. Mindfulness is kind of like an umbrella term for all of this, which really means like we're just trying to ground right back into the present moment. This is good for anxiety. If you're thinking about something happening in the future, or you're worried about something that happened in the past, practice this grounding to bring yourself just to this moment. So as I, prompt you to focus on different senses, I want you to focus on this photo. I want you to think about, first off, what are five things that in this photo you see? Could be the flowers, the plants, the dog, the collar. You could describe some of that. What colors are you seeing? What textures are you seeing? Now, I recognize you're not in this photo, so this takes some creativity. Think about if you were in this photo, what are 4 things you might hear? Maybe it's other animals. Maybe it's the sound of my dog there smelling the flowers. Maybe there's some cars or people passing by. What about smell? You're going to kind of channel what my dog is really into in this photo and think about, reflect on if you were in this photo, if you were having this experience as her, what are some things that you might smell? And I'll give you a little hint. I live kind of in like farm country, so that might get your creativity flowing as to some of the things that we actually did smell in this photo. How about feel? And this could be emotionally. What do you emotionally feel? Or physically, tangibly, what are things that you might feel if you were within this photo? Or if that's challenging, look around you. Maybe you're sitting on a chair or there's a desk nearby. What do the chair, what do the desk feel like? And lastly, this is kind of one of the hardest ones, taste. You could think about maybe you're eating a snack right now, or you have your favorite beverage with you. Or you could think about being in this photo. What would have you wanted to have with you? Maybe it was your favorite coffee or tea or some flavored water. All right. Hopefully you were able to come up with some answers and really kind of channel just what's going on in this photo, and especially if you were there. You have just learned and practiced a self-care and coping strategy that now you get to pull out of your back pocket at any point in time to help prevent distress, maybe, or maintain a baseline. Maybe you're having a decent day, but you want it to stay that way. You don't want your anxiety or stress to take you out of this moment. Maybe you want to improve any unwanted feelings or emotions. This could be a good exercise to go ahead and use. And one of the things that I like most about it is that no one knows you're doing it, right? So you could be maybe in a team meeting and you're feeling stressed, or you're about to take an exam and you're feeling stressed, and you know you need to cope, but you might not be able to pull out all of the tools in your toolbox because others might see it, could be distracting, whatever the case might be. But this allows you to just sit there in that moment as you and practice without anybody being aware that you're doing so. Now, mental health in early career veterinary professionals. Let's shift gears a little bit. State of the field. I talked in the very, very beginning that we were going to look at like what basically are the stats for psychological distress and psychologically based symptoms for early career professionals. Now, bear with me because this is going to be a kind of stats heavy slide, but I think it's good to just kind of see where are we at. Now, for the purposes of this webinar, I've kind of defined psychologically based symptoms as anxiety, depression, alcohol abuse, and eating disorder symptoms. Again, I'm going to throw out a bunch of stats here. We're just going to lay the groundwork for what we're working with when it comes to the state of the field. Now, a study by Humer and colleagues in 2023, so a pretty new study, revealed 55% of vet students that were surveyed endorsed depression symptoms. This is in stark contrast to the 28% of individuals in the general public. Now, anxiety was reported by just under 53% of participants. Again, very much in contrast to the 16% reported in the general public. High stress was reported by just above 79% of students. In the general public, that rate was 56%. Alcohol abuse in vet students, slightly higher rates than the general public here, 22.7% of vet students versus roughly 18% of the general public reporting related symptoms. And finally, eating disorder symptomatology was discovered in nearly 39% of vet students, which is an over 10-point difference than what was reported in the general public. Their rates were about 26%. What about compassion fatigue and burnout? We've got compassion fatigue, we've got burnout, both cited in frequent occurrences throughout the literature. A recent article by the AVMA cited the newest Merck wellbeing study and revealed that most veterinarians experience low to medium burnout. I'm going to break that down further. More specifically, 25% reported low burnout, 57% reported medium severity burnout, 17% reported high burnout, 1% reported very high burnout. In 2022 write-up by Cornell University College of Vet Med indicated rates of burnout are highest among, you guessed it, new grads, veterinary professionals with high student debt, not surprising, right? Because that speaks to financial insecurity, and that comes with its own whole host of different stressors. Highest among those in private practice, practitioners working primarily with cats and dogs, as well as female identifying individuals. Now, what about imposter syndrome? We've been bringing that up a lot so far today. This one seems quite applicable for new career professionals, right? It feels like we have no idea what we're doing and everyone's going to find us out. Well, one study in 2020 by Kogan and colleagues identified rates of imposter syndrome as high as 68% within the population of professionals surveyed. Females were, again, most at risk, along with, again, you guessed it, new grads with specifically less than 5 years of experience. And lastly, a study by Knipe and colleagues that examined veterinary mental health, science students, dentistry students, medical students, revealed that veterinary science students reported having a lower well-being score than med students. And I think this is the more alarming stat, 73.9%, so just under 74% of students reported well-being scores below the national average. So we've got some troubles there with well-being. Again, lots of stats I just threw at you, which I know can be a tad bit overwhelming, but there was a common thread amongst all of that data. That's what I really want to draw out from this slide. That commonality being that students and new graduates are known to be at high risk for what we've ultimately been coining all along today as adverse mental health outcomes. In full transparency, these statistics, though daunting, don't come as a surprise, because what is known about entering a new career is that it is marked by adjustment. Adjustments bring change, and change can ignite a great deal of mental distress. Think about like the pandemic and the host of different changes we had to adapt and adjust to how that really impacted our collective mental health, something that we're nearly all still trying to continue recovering from in some form. Adjustments, this is also why there's an entire psychiatric diagnosis dedicated to capturing the psychologically based symptoms associated with adjustment, that diagnosis being adjustment disorder. Now, doing our little segue here, we're going to start talking about compassion fatigue and burnout, but not without looking at the spectrum of compassion. So what is compassion satisfaction? That is the pleasure or enjoyment we gain from being able to do our work well. Think about like somewhere along the line, something happens. It's usually the accumulation of secondary traumas or maybe even repeated exposure to other suffering that leads the professional to have this like deer in the headlights experience. You know, something doesn't quite feel right, but what is it? There's a good chance that it might be compassion fatigue, or what we're seeing kind of coined as empathic distress might be the better terminology for it. What is compassion fatigue? Compassion fatigue is the unwanted outcome of exposure to others, pain, suffering, distress, trauma, and by others, I mean like people and animals. What if we don't prevent that? What if we don't mitigate that once it's happening? Burnout. We can experience burnout. Burnout is a little more intense. It's usually marked by high levels of emotional, physical, mental exhaustion. We might experience depersonalization, low sense of personal accomplishment. We might have doubts about our competence or diminished value in our work. Now, I often hear compassion fatigue and burnout being used interchangeably, and it's important to note that they're not the same. Burnout often extends beyond just work and involves feeling drained from everyday stressors like work, finances, child rearing, and it tends to be a bit more chronic and a bit more generalized. Across the board, you're exhausted. Across the board, you don't have energy for things. It's listed also as an ICD-10 code, burnout is. Now, compassion fatigue, on the other hand, is more like the strain or drain of feeling for another's pain. It tends to be acute and associated with a particular relationship or particular case maybe that you were working on. And the huge difference is it doesn't rise to that level of being in the ICD listing. So understanding compassion and compassion fatigue a little further. First, compassion. What is compassion? What does it mean to be compassionate? Compassion is a process. It's a process endured where you notice a situation where a patient or a client is suffering and you feel something toward that. That something is empathy, concern. That feeling motivates you to respond to try to resolve or relieve that suffering. Now, I think the Dalai Lama powerfully quoted it as an openness to suffering with a commitment to relieving it. And in her articles about compassion fatigue, Debbie Stone highlights compassion as a core value and an ethical imperative. Specifically cites the CVMA's Principles of Veterinary Medical Ethics, where they report veterinary professionals should provide competent veterinary medical care, with compassion. And here are a few ways that compassion fatigue shows up in the research. It's been coined as the cost of caring, as an occupational hazard, and the greatest threat to personal, professional, and financial success among those who truly provide compassionate care. Defining it once more, I'm a repetition person. I like to see it multiple times so that we know you're understanding what these different concepts are. I could probably speak for an hour on the various ways that compassion fatigue is defined across disciplines, but I think Charles Figley captured it best, especially as we see in this first definition here. He incorporates animal caregiving, so bonus points for him. He's acknowledging that it's not just hard and challenging and traumatizing sometimes to work with people, but also animals. So we see the first definition there, compassion fatigue, broadly defined concept that includes emotional, physical, spiritual distress in those providing care to another. It's associated with caregiving with people or animals that are experiencing significant emotional or physical pain and suffering. Perhaps a more like relatable definition might be, the compassion fatigue is when you are witness to the suffering of others to the point that you start to feel overwhelmed and you begin to experience symptoms that make it difficult to function. Now, burnout, as you might recall from, I think it was 2 slides ago, is more prolonged and chronic, often resulting in or from repeated stressors. It's marked by that emotional and mental and physical exhaustion. But what is very important and hope fulfilling to remember is that burnout and compassion fatigue are both treatable and they can be preventable. They can be essentially unwanted consequences of working with suffering people or animals, but things that we know with adequate tools and supports we can deal with, we can cope with. So what are some symptoms that might come up? Um, Compassion fatigue, burnout, often surface. The symptoms that often surface are things like disrupted sleep or nightmares, even. It could be repetitive, distressing dreams. Think about, if you remember during COVID times, a lot of people were talking about COVID dreams, just very vivid dreams. I think it was at that time was really speculated from just the high stress of the pandemic and being in those situations. So that might be captured through like repetitive, distressing dreams. You might also experience like a sense of hopelessness or a reduced sense of purpose. Maybe you're feeling it in your body with physical pain, headaches, digestion issues. Emotionally, maybe you're feeling anxious or irritable. Could be exhausted. You definitely see that with burnout, just exhausted. Now, linked on this slide is what's called the Professional Quality of Life Scale. This is the most used instrument for measuring like the negative or the unpleasant or the positive aspects of one's career. So that is kind of measuring like compassion, satisfaction, and fatigue in terms of what we're talking about. So some sample questions that you might see on this scale or that you would see on this scale are things like, my work makes me feel satisfied. Okay, rate that. Or I feel worn out because of my work. And you rate that. So if you're interested in kind of seeing and getting a gauge for like, where do I sit in terms of my professional quality of life, this is a good resource to go ahead and capture and put in your back pocket for when you have an opportunity to sit down and take the assessment. All right, help. I feel like an imposter. Let's shift gears a little bit to talk about something that I think we're kind of hearing a lot of these days, especially for those who are starting a new career or just plainly doing something new for the first time. Now, I'm going to read through a bunch of phrases and phrases that we admittedly have probably all said from time to time. I want you to metaphorically or literally, if you'd like, raise your hand or put a finger up with each phrase that resonates with you. Maybe you've rehearsed it 1,000 times. Maybe you just thought it once today. Perhaps the phrase or phrases even reflect an old version of you, version maybe marked by some self-doubt or uncertainty. First one, I'll never be good enough. Second, I'll try my best. Third, I can't do this. Next one, I'm a fraud. I'm just lucky. I'm sorry, but. And last one, everyone is so much smarter than me. Now, reflect once more. How many times did you either metaphorically or literally put up your hand, or how many fingers were you holding up by the end of the exercise? Were those things you once rehearsed to yourself? This is a past version of you. Or are these thoughts that you battled this morning? Also reflect, like, how did it feel in general to hear these statements? Were they relatable, either for yourself or maybe because it's something that you've observed in friends or family or colleagues? All right, what did all these phrases have in common? Imposter syndrome, which, by the way, is coined a couple of different ways. I've seen it out there as imposter phenomenon, as fraud syndrome, perceived fraudulence, or imposter experience. All of those are kind of talking about the same thing, that thing being imposter syndrome, which is how we're gonna coin it and talk about it today. All of those names are reflections in some form of the cognitive impact of imposter syndrome. Now, it's worth mentioning that imposter syndrome itself isn't a diagnosable condition. It's not like anxiety where we have that formal label to characterize the symptoms associated with it, or at least not yet. However, just because it's not diagnosable doesn't mean it doesn't happen. And it could, in fact, be a symptom of other diagnosable conditions like anxiety. We see these two tied together often. Now, some of the ways that imposter syndrome has been defined in the literature include chronically doubting one's abilities, also having an ongoing fear of being identified as a fraud, especially as an intellectual fraud, or being found out. For any of my Suits fans who watch Suits out there, think about like Mike and his ongoing fear about being found out. Now that's a little bit different because he actually was a fraud. But you can sit and kind of reflect on what were the things that he was feeling and what were the things that he was saying as he was feeling like a fraud because he was a fraud. Some of that is what we feel like and what we reflect when we're experiencing imposter syndrome, when we're not actually a fraud, but we feel like one. We also, when we're experiencing imposter syndrome, feel this urge to, or maybe actually resist positive and supportive feedback, even from those you most admire and respect. This is kind of like refusing a gift, right? Someone gives you a compliment and you're like, no, that's not me. Please don't give me that. It's like those socks that you're like, please don't give me any more socks. Thank you. But no, we see this a lot with imposter syndrome, just refusing that positive feedback. We also see having a quickness to attribute success to external factors like luck, as opposed to your own abilities, your own intelligence, or your own skills. And finally, we see feeling less intelligent, less competent than those around you perceive you to be. This is kind of like if you ever heard someone say, like, I wish you could see yourself as I see you. Right? Other people often see us much more intelligent and competent than we think that we actually are. Now, researcher Bravata and colleagues defined it best, I think, in a 2020 study. They really defined imposter syndrome as describing high-achieving individuals who, despite their objective success, fail to internalize those accomplishments and have persistent self-doubt and fear of being exposed as that fraud or that imposter. Now, zooming out for just a moment, let's take a broad look at imposter syndrome. In the beginnings, 1978, 1985 is roughly the time frame that we're looking at. That's where it got its start. You know, it's been kind of a buzzword recently, but we've actually had words to describe this phenomenon for quite some time. It was coined by two psychologists, Pauline Clance and Suzanne Imes, and their research of over 100 women who were in their, either undergrad careers, grad school, or working on their PhDs. That research held the initial discovery that imposter syndrome appeared most prevalent among high-achieving female-identifying individuals. And this was thought at the time to be primarily due to females' tendency to project their reason for success to be an external factor, whereas it was believed men tend to own their success as an inherent quality. Now, following their research, Clance also published a book titled The Imposter Phenomenon: When Success Makes You Feel Like a Fake. And the Clance Imposter Phenomenon Scale was created. That is what this QR code links you to. It links you to her website, which has the scale on it. Now, I will say, if you're interested in taking that scale, she does caution taking the scale before reading the scoring instructions so that you don't bias yourself. Now, advancing forward, what we've seen through our progression of research has been discoveries including the existence of imposter syndrome in both males and females, not just isolated to females, across many multicultural reference groups and within many high-achieving professionals. So business persons, lawyers, dentists, doctors, nurses, librarians, vet professionals. So in essence, although it remains rather prevalent in females, imposter syndrome, we now know, doesn't necessarily discriminate. Our research has also pointed to perfectionism as a potential contributing factor, which is also linked to research of vet med professionals having just kind of this inherent quality of perfectionism. Now, shifting focus to like, how does imposter syndrome surface in vet med? Probably the most fascinating part of our, of our discussions today are the research findings from Kogan and colleagues in 2020. This is the study that I referenced a little bit ago. There were 941 practicing veterinarians, so looked specifically at veterinarians. 68% exceeded that clinical cutoff score, so just under 70% exceeded that cutoff score for imposter syndrome based on this scale, the Clance Imposter Phenomenon Scale. Now, additionally, from this study, we saw female identifying veterinarians experienced higher rates than male identifying, and new graduates, less than 5 years of experience, also endorsed higher rates of imposter syndrome. These findings support a key finding from author Durston, who identified life and work transitions as a key risk factor for imposter syndrome. So again, early career professional, it makes sense as you're going through various transitions that you might start to have some of these symptoms of imposter syndrome, feeling like a fake, feeling like a fraud, like everyone's going to find you out and know that you are new at this. Now, what fuels imposter syndrome? We're going to look at this at like the individual level. What are things that we do or experience that fuels imposter syndrome? And then what are things that other people do that fuels imposter syndrome? So I want you to imagine you've just performed the best surgery of your career, or maybe even helped diagnose a very complicated case. Maybe you were the only one who could get the animal in your post-op care to drink water and eat some food. And people rally around you, they congratulate you, they offer you praise, and maybe you believe it for a moment until that imposter syndrome creeps in and you experience a flood of negative self-talk. You doubt that it was your skills that led to your success, and you instead attribute it to luck. It was just lucky that the dog wanted to come and eat some food. My hope is that these scenarios don't sound familiar, but remember what we know from that study on the last slide: nearly 70% of veterinarians are endorsing imposter syndrome. Now, in terms of prevention, we look at all the possible causes of a particular problem. Remember, I said earlier, like, it's never just the individual's fault. We can't just blame broken systems or dysfunctional relationships. More often than not, our mental health adversities, like imposter syndrome, are attributable to issues at the individual level. So that is something that I or you may be having trouble with. Dysfunctions in relationships. So maybe there's a particularly challenging colleague or a peer that you encounter, as well as faults in our systems. And those systems could be like our workplaces, our policies, procedures, etc. So with that, at the individual level, social comparison theory. Social comparison theory posits that we naturally compare ourselves to other people. And in some ways, comparisons can be a helpful tool for if it's maybe empathizing with another individual or in helping you identify weaknesses or deficits in yourself that you'd like to improve on, to be more like someone you admire. This is healthy. This is natural until it's not. And what I mean by that is when we start comparing ourselves to the point of feeling inadequate, that's no longer helpful. It's certainly not productive. So those types of comparisons can lead to negative self-talk like, I'll never be good enough. Why did I even choose this career? I'm no use here, which sparks feelings of insecurity, inadequacy, anxiety. Now, speaking of anxiety, the original research on this topic pointed to a pretty interesting cycle that's suggested to fuel imposter syndrome. First, an individual feels anxious about their intelligence, maybe their skills, maybe their competence. They think to themselves, well, if I work hard, no one will find me out. No one will realize I'm a fraud. No one will think I don't belong here. So that hard work and that diligence leads to, albeit excellent performance, and might even gain approval from colleagues or leadership. It's like, oh, that feels good. So cue the reinforcement. But if the individual never addresses those underlying self-doubts and patterns of negative self-talk, they're going to creep right back up, resisting that approval and praise. And then anxiety will be experienced all over again. And then we start that cycle. So it makes sense, right? Anxiety makes us work hard. We get approval, but we didn't address the problem. So now we feel anxious again, and we work hard and we get approval, and so on and so forth. Now you can imagine how life or work transitions fit into this bigger picture. These sorts of transitions, whether you're emerging into your career as a new grad, you're buying a home, maybe you're enduring a loss even, these can invite feelings of anxiety and self-doubt, thereby triggering imposter syndrome in your career. And finally, perfectionism has also been linked heavily to professionals in vet med. The self-imposed high expectations, as well as generally high demands placed on a vet professional, drive an individual to want to work hard to prove themselves. But the fact of the matter is that none of us will get it right 100% of the time. When we base our self-esteem on accomplishing tasks perfectly, knowing that can't be done, the result leaves us feeling like a fraud or a phony or imposter, especially if we make a mistake. Now let's talk about our relationships or organizations in which we belong. Accepting the status quo. Bear with me here. What if we accept the status quo in how a colleague treats us? I referenced author Durston a little while ago. She wrote the book Emotional Wellbeing for Animal Welfare Professionals, and in it was a really powerful testimonial from a vet professional who just started a new job. So work, career, life transition. She was instructed to assist the head surgeon, and she stated they didn't even look at me at all. The head nurse asked if she, meaning her, even qualified. She went on to say that she talked with other colleagues about the encounter, and they just, kind of reassured her, oh, that's just how they are. They're like that with everyone. And to that I say, no, it doesn't get to be used as a free pass for any of us. We can't merely accept the status quo of others' judgment or of a judgmental workspace just because that's the way it's always been. So though we all have an individual responsibility to monitor and regulate our emotional responses to others who might be judgmental or harsh toward us, we just as equally have a responsibility to be mindful of our tone and our verbal and bodily language that we use toward others. We can't just freely fuel others' self-doubts and anxieties and imposter syndrome and not take some of that accountability in some way. So what can we do instead? We can promote an environment of psychological safety, which helps to buffer against the absence of psychological safety as that risk factor for imposter syndrome. And what this means is that we work to develop an environment where conversations are had openly and with non-judgment, and we respect differing opinions. We invite opposing feedback to help everyone feel seen and heard and understood. In an environment like this, we also work to lift others up with praise and positive affirmations, all again from that stance of non-judgment and empathy for what others might be going through. We might also establish opportunities for mentorship. Mentorship is huge, not just in the vet profession, but in life in general. Mentorship is very powerful. Helps to reduce feelings of isolation and promote that supportive environment for one another. And then finally, as we've talked about, it's no surprise that there's high expectations in vet med. And it's no surprise that that would be linked to imposter syndrome. And to an extent, some of these expectations might never be lowered, right? Like there's a lot of pressure on vet professionals as you're dealing with an animal's life. And you're also battling at the same time, like gaining trust from their owner to take the utmost care of their best friend. But what we can do is encourage one another. We can gently remind ourselves and our colleagues that there's no expectations to be perfect, just trying to do our best job every day. We can help to reframe the organizational culture to be one where mistakes are viewed as learning and growth opportunities and not as a perceived sense of failure. Okay, so from imposter to empowered. Let me go back a moment. So these were our original imposter syndrome statements. We're going to do a little bit of an empowerment exercise. I think awareness is key in facilitating any healthy change around imposter syndrome, which is why we initially ran through that exercise of, going through these different imposter syndrome type statements. Once you're mindfully aware of how you talk to yourself, you have that power to change the language you use to describe yourself and how you feel. This in turn helps to facilitate more pleasant feeling and productive behavior. So let's reframe, shall we? Now, the first statement was, I'll never be good enough. How do we reframe that? I've earned this and will continue to grow. Second statement was, I'll try my best, which is marked by a little bit of doubt. So how do you get more confident in that? I will do it. Third one was, I can't do this. We reframe that to feel a bit more empowered. I'm prepared for the challenge, right? Give credit to your schooling and your training that you're working so hard. You are prepared for the challenges that you'll face. Next one was, I'm a fraud. And we reframe that plainly to, I am not a fraud. I am capable. Next one was, I'm just lucky. Nope. I've created opportunities through my hard work. Next one was, I'm sorry, but, and we reframe that to, I believe that. And last one was, everyone is so much smarter than me, and we can reframe that to feeling a bit more empowered. I deserve a seat at this table, because it's true. You deserve to be there. Your input is important. Now, early career resilience. Let's take us back to where we first got started in the title of today's presentation. We're going to talk about stress management and preventing mental health adversities. Now, I mentioned in the beginning that this is all about awareness building today. And one of the first steps you need to be able to prevent or intervene is awareness of warning signs. So here on this slide, I have laid out a couple of warning signs for imposter syndrome and then just psychological distress, different symptoms that might come up just by being a human and also, working in a new career. So imposter syndrome, things like not speaking up or not volunteering information at team meetings. Maybe you use self-deprecating language, or you are being described as, or maybe you describe someone else as perfectionist. Staying at work longer than expected is also seen with imposter syndrome. Now, psychological distress might be marked by catastrophic or worst case scenario thinking. You might have the ongoing need to fact check, either internally or with someone else. You might be restless or have difficulty focusing, or maybe you're described as scattered. You might misuse or abuse substances, or have some symptoms of depression, hopelessness, missing deadlines, missing work, calling out frequently. Maybe you feel sad on a pretty chronic basis, or you're irritable, or you're angry, or reckless. Maybe you isolate yourself from others. Now that we know the warning signs and we know that mental health adversities in general can be preventable, I won't say 100% of the time, right? Because that's not necessarily true. We know ultimately that they are preventable, and you probably don't need me to tell you that, but the question becomes really, once we have awareness of the warning signs, whose responsibility is it to facilitate this mission of preventing or mitigating, if they're already happening, different mental health adversities? And the answer is it's a collective responsibility. I've kind of been alluding to that all along. In essence, the individual is responsible for their well-being, but so are the individuals with whom they have relationships. So their communities at large and social groups, as well as society at large. We know that we exist as a social species to help one another grow and to help one another thrive. But when it comes to supporting ourselves through intervention and prevention, the first way we'll look at this is through intervention, meaning that maybe you've really resonated with some of the warning signs and the content in this presentation and you're ready to make a change. We do that by intervening. But first and foremost, you have to have that openness to accept help and facilitate change. I'm just going to go ahead and click through the slide so that we have all the content up there. Ultimately, like if you're not ready for that change, recovery from things like anxiety or imposter syndrome or depression or life transitions in general will probably be challenging, not impossible, but an added challenge to your recovery. Now, what are some indicators you might be a good candidate for intervention? Things like therapeutic treatment, for instance. We see that in bullet number 1 there. It might be like when you recognize symptoms impact your work and personal relationships, or when they feel unmanageable or debilitating. That might be a good indicator it's time to intervene. Some different effective therapy treatment approaches that are out there for some of the issues that we discussed today are things like cognitive behavioral therapy, acceptance and commitment therapy, mindfulness-based therapies, or even trauma therapies can be helpful in light of the different traumas that you endure professionally and maybe even admittedly personally. Consultation with a prescriber or a psychiatrist might be a viable option to help treat some psychologically based symptoms through medication. And finally, we have here in the US and Canada, 988, or if you are outside of those areas, a crisis equivalent that could be used to not only help mitigate and regulate distress for yourself, but is also a useful aid if you're recognizing distress in a colleague or a friend or a family member. It's okay if you don't know how to navigate those situations. You can leave it to the professionals, right? And a crisis hotline is one resource to get in touch with those professionals. Now, when it comes to preventing future symptoms from appearing, you'll want to follow any treatment plans if you've sought treatment. And if you haven't sought treatment, but you really are truly just trying to be on the preventative end of things, you want to create kind of like what I like to call a wellness plan for yourself, which we're going to practice in just a moment. Of course, you want to avoid use of drugs and alcohol, and you want to practice healthy coping skills both when needed and when not needed. And this is probably one of the most crucial pieces of information. Lots of people come into my office and, when they're feeling good, their coping skills go to the wayside. And to that, I always say you have to be practicing the skills both when you're feeling good and when you're not feeling good. When you use them when you're feeling good, it helps kind of prime them and make them easier for when you're not feeling as good. Now, I talked about this wellness plan or wellness prescription, and I call this kind of our stress management 101. Now, of course, you don't have to do all of these things as quote unquote prescribed here on this slide, but this gives you a little idea of different things that you could incorporate to help bust some of that stress that you might carry both as a student, as a new professional. So first one, practice self-soothing activities daily as needed. Self-soothing activities could be things like a bubble bath, aromatherapy lotions, a face mask, maybe even some deep breathing. Second one, incorporating mindfulness exercises. We already did one of these today. We did the 5, 4, 3, 2, 1 sensory grounding. That is an exercise you could practice, or cognitive grounding. Cognitive grounding is a little bit more, using a little bit more of your thoughts. Some people like to, this is going to sound silly, but go through all of the cereal brands. You just think to yourself, what are all of the cereal brands? Or you go through the alphabet and you think about foods, maybe that start with each letter. A is for apple. B is for, I'm already stuck. But you could go ahead and use that kind of exercise to really pull your mind away from just whatever stressors or anxiety that your mind is gravitating toward. Now, number 3, loneliness. We know that's a huge risk factor for poor mental health outcomes, and we can all sort of, again, relate if we consider the pandemic and the subsequent feelings of loneliness and isolation that created and how that affected us mentally. So challenging yourself to reach out to a friend, for instance, every day or close to every day may not only benefit them, but it also promotes positive social engagement for yourself. Now, how about rehearsing positive self affirmations? What we know based on our research on neuroscience is that sending positive messages to ourselves can literally help in rewiring our brain. How we talk to ourselves matters. So, if we rehearse self defeating statements, we can expect to feel defeated and sad and anxious and like an imposter. But if we train our brain to think differently about ourselves by rehearsing affirmative, positive statements, we will, in time, this takes time, actually feel that way about ourselves. And how about integrating pleasurable activities? This works to help enhance our overall quality of life, especially if you're dealing with challenging clinical cases or those ethical dilemmas like we talked about. You want to think about what relaxes you or what even helps to distract you maybe. Maybe it's a favorite TV show, maybe it's a book that you've been reading, maybe you like doing puzzles or cozying up with a warm blanket. Maybe it's even setting aside time to just sit in silence a few minutes each day. And then lastly, intentional movement. No doubt about it, intentionally and joyfully moving our bodies has tremendous mental health benefits. So you might incorporate things in your daily routine like dance or yoga, walking with your pet, light and gentle stretches to help really gravitate towards soothing the body, soothing the mind. And lastly, as you're getting ready to embark on, a brand new career, the question comes up what do I look out for in a workplace? And this list that we're about to run through is, of course, not all encompassing, but gives you a little bit of an idea of, maybe some interview question directions, things to look out for, things to stay away from. So first and foremost, efforts to reduce workplace stress. This could be done through, evidence that there are manageable workloads, or there's reasonable work schedules, or there's administrative support for you and for your administrative staff. Next, minimizing euthanasia stress. This might be, you could ask questions about, is there time for debrief if you feel like you're someone who would need a debrief? Are there options to opt out of euthanasia? Are there resources for clients to prevent things like convenience euthanasia? And are there resources for you as the professional, like EAP or counseling or veterinary social workers on staff? And then next, we see interventions for coping with stress. These you want to see kind of promoted by leadership. Again, it might include those EAPs, employee assistance programs, counseling interventions, maybe continuing education, specifically about different occupational hazards or efforts to promote psychological safety in the workplace. Promoting social support is always a good indicator of a healthy workplace. That might be encouraging and having a supportive group environment, promoting team building, all those exercises that no one really likes, but we also like because it does help us feel connected to other people. Might also see promoting initiatives within the institution that you're working or even your schooling right now to promote self-care. Maybe it's through mindfulness trainings or creating ongoing well-being initiatives that people and employees can participate in. Maybe that's having wellness coordinators on site. And lastly, attending trainings like this can equip leaders, staff, students, faculty with the awareness of warning signs and effective ways to help others in distress. So by watching this, you are already taking favorable steps in the right direction. Now, lastly, I just want to point your attention to, this is a resource guide that I am always evolving as I do different presentations and come across new research and resources. All of NOMV's Not One More Vets resources are linked on this resource guide. So this is another one of those things that could be helpful to just capture through the QR code and put in your back pocket in case you want to take a little dive into some supportive resources and literature that's out there. And here are some references used for today. finally, I just want to thank you, not just for being here today, but for making the active choice to show up for yourself and learn about this important topic. I want to thank you for your service and commitment to the veterinary profession. As a pet owner and an avid dog lover, your hard work and dedication do not go unnoticed. On this slide is different ways to get in touch with me, my LinkedIn, website, email, should you have any questions or any thoughts or you want to connect after the webinar. I want to thank everyone for being here today.